Hello, everyone. Thank you for joining us to learn more about how to assist students in times of crisis. We know faculty and staff are genuinely invested in the well-being of their students, but often feel unprepared to support them in times of crisis or extreme stress. This presentation is meant to provide some tools to assist you in supporting students. Today we will be covering crisis response, as well as how to listen with concern and empathy, assess for risk of suicide, reflect, which means collecting additional information about the situation, validate feelings, connect, care, and follow up with the student, as well as university resources that can be leveraged to provide assistance. What we will not be covering today. We will not be talking about normative stressors and general feelings of being overwhelmed. If students are expressing what might be considered normative stress, lots of work, poor time management, etc., then it is appropriate to refer them to Let's Talk for students who do not want or may not need therapy, and or self-help resources available through CAPS at health.rutgers.edu or 848-932-7884. Many faculty, instructors, and staff are hearing painful realities from their students in this time of national crisis and may feel unprepared to address issues such as death, trauma, homelessness, hunger, job loss, childcare, domestic violence, sexual assault, and uncertainty about their education. A crisis is a time of intense difficulty, trouble, or danger, and everyone experiences a crisis at some point in their life. We may have had similar emotions, such as fear, anger, shame, anxiety, and sadness. We might have thought, why is this happening to me? When will this be over? Or what am I going to do? Recognizing that while our crises may differ, we can all understand the feelings and thoughts that accompany a crisis, and that can help us understand how our students are feeling right now. Recognizing when someone is in a crisis is the first step in providing assistance. This brief overview will provide information and tools you can use when students are disclosing difficult information. No one is expected to become a student's therapist, but instead, a person who can recognize someone in crisis, validate their feelings, and connect the student to valuable resources that can assist. You may be hearing all of this via email or by phone from your students. If it is an email, take your time reading and rereading the emails. Before you respond, note any questions or clarifications you might have. You are not interviewing them, but you do want to make sure you are understanding what they are telling you. If this is happening during a phone call, you can paraphrase to make sure you are understanding them correctly. Not everyone reacts to trauma, crisis, or difficulties in the exact same way. Some might be very upset, others matter of fact, and other people flip or making jokes. These reactions do not diminish the experience that they are having. It's important to normalize feelings. Everyone's feelings are normal and valid. Ask about their immediate needs. Do they need groceries, a safe place to stay, internet service, or someone to talk to about the current situation? Acknowledge that what they need now may change in the future, but those needs now impact how they feel and manage other aspects of their life. Knowing immediate needs may also inform the resources that you provide. Please do offer to make time to talk either by phone or WebEx so that you can connect to the student directly. If you are worried that the student might be at risk of suicide, it is okay to ask them. You can use these samples or paraphrase. Be direct. With all the pain you've been experiencing, I wonder if you're thinking about killing yourself. Or, sometimes people who have experienced difficult situations have thoughts about killing themselves. Do you have those thoughts? We know this is scary and difficult to do, but being direct is the most shame-reducing way to ask. Many people worry that by asking they are giving people an idea that they had not thought. This is not true. In fact, by asking, you are validating their feelings and providing a safe outlet. If they do say yes, be prepared to refer them to CAPS immediately. You will leave a voicemail with your name and phone number and the student's name and RUID number if you are the person calling. A clinician will call back as soon as possible. If the student is calling, please tell them that they will leave a voicemail with their name and phone number and their RUID number. Thank them for telling you. You can call CAPS for a consult as well. After business hours, call CAPS and Access Protocol, a hotline staffed by mental health professionals. In addition, there are several hotlines you or students can utilize, including acute psychiatric services at 855-515-5700, the National Suicide Prevention Hotline, 800-273-8255, the New Jersey Hope Line, 855-654-6735, and the National Crisis Text Line. All anybody has to do is text 741-741. It is important to validate feelings, and it is okay to say, I am so sorry this is happening to you. It makes sense that you feel this way. You are right. This is awful and scary. I am scared too. Thank you for letting me know what's going on in your life and how you are feeling. Always thank them for talking with you. It is hard for students or anyone to admit they are struggling and in pain. They also might have a range of emotions from sadness and fear to anger and frustration, even guilt. All of these feelings are valid and understandable. Connect, care, and follow up. Offer reassurance and comfort. We cannot say everything is going to be okay because we do not know that that is the case. What we can say, I know that the current situation is not going to last forever. There are many caring people at Rutgers and units who have resources to support you. We can help you find the tools to cope with this situation. Ask what usual supports and coping mechanisms have helped them deal with difficult situations in the past and if they have utilized any of them. What are helpful first steps that they can take alone, with others, or with you? Explain that withdrawing or not asking for help is a common reaction, but can keep them feeling stuck and less in control. Once you clarify the need, be prepared to offer them university resources and supports. In a few moments, we will be reviewing the various resources that are available to students. It would be great if you could follow up with the student and ask if they have utilized any resources. Remember, it is up to the student what they would like to disclose. Do not pressure them. You can offer to talk by phone or via WebEx. There are numerous resources to assist students virtually during this time. Let's start with Rutgers Student Health. The Hurtado Health Center on College Avenue remains open but with limited staff and hours. Hours of operation are Monday through Friday, 8:30 a.m. to 5 o'clock p.m. All regular services such as physicals, sexual and reproductive health, medication refills, and management of acute and chronic conditions continue to be available. Most services are provided via phone consultations and telehealth video visits. Limited in-person appointments are also available when deemed necessary. The laboratory is open when blood work is required. Use of the patient portal to schedule appointments at Hurtado is currently suspended. To schedule an appointment, students should call 848-932-7402. Regardless of whether they use Rutgers Student Health or another healthcare provider, if students experience symptoms of COVID-19, coughing, fever, shortness of breath, or feel they have been exposed, they should call their healthcare provider for a consultation. They should not just walk into a provider's office. CAPS. Although all CAPS locations are physically closed, services, including Let's Talk, are available remotely via phone consultations and telehealth video visits. CAPS is also offering virtual workshops. Use of the patient portal to schedule appointments with CAPS is currently suspended. To schedule an appointment, students should call 848-932-7884 and leave a voicemail with their full name, phone number, and RUID number. Their message will be returned within 1 hour during regular business hours. If a student is in crisis, they should call 848-932-7884. An on-call clinician will call back as soon as possible. If it is after hours, students can still call CAPS and Access Protocol, a hotline staffed by mental health professionals. Hope is offering virtual live mini workshops, recorded events, and other resources. Follow RU Student Health on Facebook, Instagram, and Twitter to keep up to date on all health promotion resources. Offerings are listed on the same page, noted in the slide. The Dean of Students can assist with academic issues, financial aid, and other circumstances. It is best to contact them through email at deanofstudents@echo.rutgers.edu. Students will receive a same-day response. The Rutgers Food Pantry is open and operating by appointment only from the Graduate Student Lounge. Appointments are available Monday, Wednesday, and Friday between the hours of 12 p.m. to 3 p.m. Appointments must be made one day in advance and can be made at signupgenius.com/go/RU Food Pantry. Violence prevention and victim assistance is also available. Students may be in situations that place them in danger of sexual assault and domestic violence. VPVA can provide support and counseling. Their hotline, 848-932-1181, remains operational and will continue to provide 24/7 crisis response for anyone in the Rutgers community who needs it. Legal services. Many students are having issues with landlords, leases, and not being able to pay their rent. Students can schedule appointments by emailing sls@echo.rutgers.edu. Please remember, this is a significantly reduced training. CAPS is offering Coffee with CAPS over the next several weeks for faculty and staff. For dates and the WebEx information, go to health.rutgers.edu/virtual-resources. In the coming weeks, information about Campus Connect Suicide Prevention Gatekeeper training will also be available on the site. We hope that you found this helpful. If you have additional requests for education and outreach from CAPS, please contact Anne-Marie Wakamontes. For education and outreach related to mental health, alcohol and other drugs, sexual and reproductive health, and nutrition, contact Francesca Maresca. And as always, thank you for supporting our students.